Welcome. Today we will diving deep into Polycystic Ovary Syndrome or PCOS. If you are struggling with symptoms or looking for ways to manage it, this video will cover everything you need to know, from the science behind PCOS to practical treatments and lifestyle changes. Whether you are a student or someone dealing with PCOS yourself, this video will help you understand how to take control. PCOS is a hormonal disorder that affects 6 to 12% women globally. It is a condition where the ovaries produce more male hormones or androgens than normal, which affects a woman's menstrual cycle, fertility, and even physical appearance. It's not just a reproductive issue. PCOS also comes with metabolic and endocrine challenges like insulin resistance that can have long term effects. Let's break down the pathophysiology or how PCOS develops inside the body. This condition is influenced by genetic and environmental factors. This lead to insulin resistance, where the body's cells do not respond well to insulin. This increases insulin levels, a condition known as hyperinsulinemia. This higher insulin level lowers the SHBG or sex hormone binding globulin because insulin inhibits the liver's production of SHBG, resulting in higher levels of free androgens like testosterone in the bloodstream. Increased androgen production leading to higher levels of free androgens or male hormones in the body. Increased androgens disrupt the ovaries, resulting in anovulation, meaning the ovaries do not regularly release eggs. Over time, this leads to polycystic ovaries with multiple small cysts. The hormonal imbalances causes symptoms like irregular periods, acne, hirsutism, etc. Now, what are the symptoms or clinical manifestations? So, women with PCOS may experience a variety of symptoms which can vary in severity. The primary clinical manifestations include menstrual irregularities. This is often the first sign. Women may have infrequent or prolonged menstrual periods called oligomenorrhea or even absence of menstruation called amenorrhea due to anovulation. Hyperandrogenism, elevated levels of male hormones, which leads to hirsutism. Excessive hair growth in areas like face, chest, back. Acne, persistent and severe acne not confined to teenage years. Androgenic alopecia, thinning of scalp hair or male pattern baldness. Polycystic ovarian morphology. As we will discuss later, the presence of multiple follicles in the ovaries is a hallmark feature. Weight gain and obesity, particularly central obesity around the abdomen, which worsens insulin resistance and increases the risk of metabolic complications. Infertility. Due to chronic anovulation, many women with PCOS face challenges in conceiving. Metabolic issues, including insulin resistance, type 2 diabetes mellitus, high dyslipidemia or abnormal lipid levels, and hypertension. These are metabolic issues. Now, mood disorders. There is a higher prevalence of anxiety and depression among women with PCOS, which can impact quality of life and overall health. So, understanding these symptoms is crucial for early diagnosis and effective management of PCOS. Polycystic ovarian morphology. One of the defining features of PCOS is polycystic ovarian morphology, observed through an ultrasound. Okay, let's break down what this entails. Ovarian volume. The ovaries are often enlarged, typically more than 10 millimeter in volume. Follicle count. Each ovary contains 12 or more small follicles, each measuring between 2 to 9 millimeters in diameter. These follicles are immature and have failed to mature and release eggs during the menstrual cycle. String of pearls appearance. The follicles are arranged around the periphery of the ovary, giving it a string of pearls look on the ultrasound image. You can see here. It's important to note that not all women with PCOS will have polycystic ovaries, and not all women with polycystic ovaries have PCOS. Therefore, diagnosis typically requires a combination of clinical symptoms and ultrasound findings based on the Rotterdam criteria. Managing PCOS typically involves a multifaceted approach tailored to individuals' symptoms and reproductive goals. Here are the primary treatment strategies. Lifestyle modifications, including diet. Adopting a low glycemic index or GI diet helps manage insulin levels. Focus on whole grains, vegetables, lean proteins, and healthy fats, while avoiding refined sugars and processed foods. Exercise. Regular physical activity improves insulin sensitivity and aids in weight management. A combination of aerobic exercises like walking or swimming and strength training is recommended. Medications. So, oral contraceptives, these regulate menstrual cycles, reduce the androgen levels and help alleviate symptoms like acne and hysterism. Metformin, primarily used to improve insulin sensitivity. It can also aid in weight loss and restore regular menstrual cycle. Anti-androgens. Medications like spironolactone or finasteride help reduce excess hair growth and acne by blocking androgenic effect. Ovulation induction agents. For women seeking to conceive, clomiphene citrate or letrozole can stimulate ovulation. Gonadotropins. In cases where other ovulation induction methods fails, injectable hormones may use to promote ovulation. Fertility treatments. In vitro fertilization. An option for women who do not respond to ovulation induction medications. In vitro fertilization is best for this kind of women's. Assisted reproductive technology or ART. Techniques like IUI or intrauterine insemination may also be employed depending on individual circumstances. It's essential to work closely with a healthcare provider to determine the most appropriate treatment plan based on the personal health goals and severity of PCOS symptoms. Now, fertility with pregnancy. So, fertility can be significant concern for women with PCOS due to chronic anovulation. However, with appropriate interventions, many women with PCOS successfully conceive. Here is how. Lifestyle changes. Weight loss through diet and exercise can restore ovulatory cycle, improving fertility. Ovulation inductions. Medications like clomiphene citrate or letrozole stimulate the ovaries to release eggs. Letrozole has recently gained favor due to higher pregnancy rates and fewer side effects compared to clomiphene. Metformin. In some cases, especially when insulin resistance is prominent, metformin can enhance the effectiveness of ovulation induction agents and promote regular menstruation. Now, the pregnancy consideration. Women with PCOS are at an increased risk of gestational diabetes and hypertension during pregnancy. Therefore, close monitoring and management by healthcare professionals are essential to ensure a healthy pregnancy outcome. Diet. Managing PCOS through diet and exercise is crucial. Focus on low glycemic foods like whole grains, vegetables, lean proteins, which help regulate insulin. Incorporate healthy fats like omega 3 fatty acids from fish and nuts. For exercise, aim for at least 150 minutes of aerobic activity with walking or swimming each week, combined with 2 to 3 strength training sessions. You can also add high intensity interval training or HIIT to boost fat loss and improve insulin sensitivity. So, in summary, polycystic ovarian syndrome or PCOS is a multifaceted condition that intervenes hormonal, metabolic, and reproductive health. Early diagnosis is essential for effectiveness management and to prevent long term complications. Lifestyle modifications, particularly diet and exercise, are fundamental in managing PCOS and improving insulin sensitivity. Medical treatments, including hormonal contraceptives, insulin sensitizing agents like metformin, fertility treatments, provide targeted relief for specific symptoms and fertility challenges. Remember, each woman's experience with PCOS is unique, and a personalized treatment plan is key to successful management. By understanding the pathophysiology, recognizing the symptoms, and implementing comprehensive management strategies, women with PCOS can lead to healthy, fulfilling lives and achieve their reproductive goals. Thank you for joining me in this comprehensive overview of PCOS. If you have any questions or topics you would like to explore further, please leave them in the comments below. Don't forget to subscribe to our channel for more in-depth health insights, and like and share this video if you found it helpful. Remember, knowledge is power, and together we can navigate and manage PCOS effectively. See you in the next video. Thank you.